So I'm going to take myself off camera. I know we're already recording and we'll jump right in. And so today's topic is risk management or applied hazard communication. Okay, so digging on in. So first we're going to review what we've talked about the past 2 weeks. So in week one, we talked about OSHA's hazard communication requires that employees be trained about the right to know about the hazards of chemicals in the workplace. And that's really the starting point for this particular course. We took that same information and just turned around it and made it public facing. The 1986 Emergency Planning Community Right to Know Act also says that community members have the right to know about hazardous substances in their communities. So that 1986 EPCRA Act is also our foundational document. That's why we have a local emergency planning committee here in Jefferson County. We developed this course because along with the right to know comes the responsibility to understand, and knowledge is power. And we want everybody to be part of this conversation. So getting into the nuts and bolts of it, we talked about just because the material is hazardous doesn't mean it has to be dangerous. So what's the difference? So if you know what the chemical is, you know the hazards of the chemical, you know how to manage the hazards of that chemical, and you do effectively do the thing that enables you to manage those hazards, then it becomes a mitigated risk, right? The hazard of the chemical is inherent, but you've mitigated the imminent danger of the chemical by managing it. We're going to talk a little bit more about that today. We talked about hazardous chemicals can be sliced and diced several different ways. We can look at their physical hazards, what a chemical is going to do, or their health hazards, what the chemical is going to do to me, do to you. We talked about 4 basic, big, broad categories of chemical hazards: flammables, corrosives, reactives, and toxins. And there are regulatory subcategories and divisions within those big, broad buckets, but those are the big 4. And we talked about how the effects of a hazardous chemical can be acute, meaning happening right here, right now, or it can be chronic, something that's going to develop and manifest itself over time. When we're talking about toxins, we talked about 4 possible pathways of exposure. We talked about inhalation, ingestion, absorption, and injection. Inhalation, of course, is being exposed to a excessive concentration of a chemical in an atmosphere. Ingestion includes water contamination, contamination of foodstuffs. Absorption and injection do require direct contact with the physical chemical. So those are really much more of a concern in a workplace setting, an occupational exposure. In the public health realm, we're not usually talking about direct contact through either absorption or injection. We're talking about toxins. Remember, toxins are poisons, right? In order to be adversely affected, you need to have a source, a pathway, an exposure, and that exposure has to be above its toxic dose. So if the exposure is below the toxic dose, you can still have the exposure. We talked about people wading in Lake Erie. Lake Erie is not pristine water; it's not free of chemicals, but the chemicals are dilute enough that they're not causing an overdose. And we said the dose makes the poison, right? That was Paracelsus, the first person to put that together. And we talked about the example of the 588 pairs. So just because a chemical is present does not mean it is harmful in the amount present. So you would have to have 588 pairs to get a toxic dose from the naturally occurring levels of formaldehyde in the pairs. Okay, we finished off session 1. We introduced you to OSHA's globally harmonized system and those 9 pictograms you see there that have been in use since 2012. Those are primarily designed for workplace labeling, but you can see those also on some commercial chemical products. In transit, you're also going to see labels and placards that are going to have some of these same pictograms, may have different pictograms, but we showed you what those look like. We also showed you the NFPA, National Fire Protection Association placard, the blue, red, yellow, and the white field. On a scale of 0 to 4, where 4 indicates the highest level of hazard and 0 means it's essentially a negligible hazard for that category. We introduced safety data sheets as documents that can provide detailed information, but it's going to be specific to a workplace use of a chemical product. It's written by the chemical manufacturer or distributor, and it's intended for the workplace user. It's also not intended as an emergency response document. It's intended to give you upfront information before you would work with the chemical for planning purposes. We talked about the NIOSH Pocket Guide to Chemical Hazards, and I shared that web link there. This is OSHA's twin sister, and they maintain this online database that gives you very complete, very reliable data about several hundred different chemical compounds that we might encounter. And then we talked about the Department of Transportation's Emergency Response Guidebook. This is the go-to for two-step quick lookup information for emergency response to a chemical. We said you can look it up alphabetically in the blue pages or numerically by its 4-digit number in the yellow pages. And then that'll jump you to the orange guide there, which will give you 2 pages of what to do about this kind of chemical when it is either released or, on fire or anything like that. We did talk about using the green pages for downwind protection distances from toxic inhalation hazards. Then we came back again last week and we expanded on that with our discussion of air emissions. At the outset, we said that different chemicals are regulated differently because they have different hazards. And if you can drill down even further, different air pollutants are regulated differently because they have different hazards. Additionally, the air regulations have evolved over time. So while we still regulate some of the same chemicals that we've been regulated for the past 57 years of the Clean Air Act of 1970, over time, we've added new regulatory programs because as we learned more and understood more, we're going to do better. So different programs don't have the same amount of time of implementation. But those programs are reviewed and adjusted and revisited every few years to make sure that the numbers hold up. When we talked about accidental releases, we said it's most important to ask what was released and then to understand its hazards. So even if this is something happening in real time, if the news media is saying, well, this is the chemical, you can look it up in the NIOSH Pocket Guide. You can look it up in the DOT Emergency Response Guidebook and start to anticipate what the hazards of its chemicals hazards are going to be. Also, we talk about different kinds of hazmat incidents. Not every hazmat incident is going to be catastrophic, but then there are other catastrophic incidents that may not be hazmat incidents. Technically, an overpressurization incident could be anything that overpressurizes, not necessarily a hazmat. We saw that with the Givaudan and D.D. Williamson explosions, overpressurizations of those process tanks that overheated and ruptured. We did talk about toxic inhalation hazards. We introduced these acute exposure guidelines, the AEGLs, where an AEGL3 exposure closest to a source could be a fatal exposure. AEGL2 is going to be slightly removed, and they may be survivable, but in a really bad way. And AEGL1 exposure is the least measurable amount of adverse effects. And then there's null, the no observed adverse effect level, who's getting an exposure, but it's below the toxic dose. He has no adverse effect. And we talked about modeling TIHs, those toxic inhalation hazards, that the plume dispersion can be modeled to determine the toxic endpoint. In the event of a TIH release, we should call a shelter in place, which gives you time to reduce your exposures to a safer level. So if you would have been in the direct path of the plume and maybe could have gotten a fatal exposure, if you can effectively shelter in place, you can definitely have a survivable exposure. Surviving is better than dying. Or maybe you were in the zone to have a serious exposure, but you could minimize that to simply a temporary or transient exposure by sheltering in place. We talked about getting inside, getting everybody inside, staying inside, shutting off your HVAC systems, waiting it out. Don't go to the basement because these fumes could be heavier than air and could accumulate down there. And then Sarah talked about signing up for lens alerts so that you would get these notifications in real time when something is happening in our community. Okay, so today we want to introduce this concept of risk management. We've kind of talked around this, but on this slide, I've got those 5 arrow definitions there, and I'm not going to read those word for word, but when we talk about risk management, okay, this is, it's a proactive management strategy to effectively assess the hazards and then address them so as to minimize them. So it's always proactive. It's not reactive, and it's methodic. Okay, you're looking at it. You're assessing the whole scope of your hazards, and you're developing mitigation protocols to minimize those hazards if or when they would occur. So some examples. When we talk about risk sounds, it's a word that we all know, we all use, but when you look at risk management strategies, risk is actually the product of probability and severity. Okay. A high risk hazard is going to be both likely and have a certain level of severity. If something is incredibly probable, like rain, but have a low impact like rain, you're not going to spend a whole lot of time over planning for that. If something could be incredibly severe, like, an atomic bomb, but highly unlikely that an atomic bomb is going to drop on Louisville, Kentucky, you're not going to spend a whole lot of time planning for that either. You're going to look for the things that are likely to happen and likely to have a severe consequence. So this table here, this is a mock-up, but it's very similar to a thought exercise that we would do in industry. We'll just list all the threats we could think of. And so this short list here, we have nuclear annihilation, airplane crashing into the site, hazmat fires, hazmat releases, heart attacks, slips, trips, and falls, COVID-19, active shooter, earthquake, and rain. And for each one of those, on a scale of 1 to 10, we said, what's the probability that that's going to happen? And then we said, for each one of those, what's the severity if that were to happen? And then when you multiply those two numbers together, you can get a quantifiable numerical score that helps to sort out where should you really be placing your attention. And in this made up example, the hazmat fires and the hazmat releases both rose to the top because they're probable enough that they would or could happen, and the outcome could be severe enough that it's worthy of your time and attention. And so at the most basic level, if your facility was doing a true risk management exercise, you would rank these risks in an order like this and look at both the probability and the severity, multiply those together, and then put your attention where you're going to get the biggest bang for your buck, where you're going to get the most response, the most value for the effort that you're putting into it. Okay. These two slides, this one and the next one after it, were not part of our original slide deck when we put this course together 2 years ago. But these kind of came in response to questions that people were asking us. And in particular, this was from a conversation in a meeting of the West Jefferson County Community Task Force. And that's a community advocacy group. And I was tuning into one of their meetings about a little over a year ago. And one of the members of the community who were on the call said, well, do these facilities have, emergency response plans in place? What are they planning to do if something bad happens? And it occurred to me, I work with this day in and day out, but our neighbors don't know what we're already doing. So there are many overlapping regulatory programs. OSHA, the Occupational Safety Health Administration, has regulatory requirements for facilities. EPA, the Environmental Protection Agency, has regulatory requirements for facilities. The Department of Transportation has requirements. Department of Homeland Security. There's all sorts of overlapping regulatory programs that, as an operating facility, in order to have permission to conduct our operations, in order to be compliant, we have to meet at a minimum these requirements. So starting with the OSHA ones, OSHA does require every facility with more than 10 employees to have an emergency action plan. And you have to look at the different kinds of hazards that can be posed at your facility. You have to have evacuation, assembly, and accountability procedures. You have to look at natural disasters like severe weather events, as well as chemical hazards, as well as fires and explosions. All of that is considered in your emergency action plan. OSHA also requires fire prevention plan. So that's not a response plan, but is a prevention plan where you have to, go to 1910.39 and it'll tell you, you need to consider this, 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 and this. And then so you build your fire prevention protocols accordingly. Certain facilities, certain sites that have chemicals in large bulk quantities are required to have a OSHA process safety management plan, PSM. So these are going to be usually for large chemical facilities or large facilities that have large inventories of chemicals. And they're either highly flammable chemicals or highly toxic chemicals. And the toxicity, the more toxic a chemical is, the lower the threshold is. So if you have less of something highly toxic, you're in PSM. If you have more of something that's not as toxic, you can be in PSM. And this PSM program is requiring layers of protection for your facility. So every facility has an emergency action plan. Every facility has a fire prevention plan. But the PSM facilities have additional requirements to go above and beyond, and they're required to do certain things because they have these large quantities. The probability is greater that they might have an incident. So in response, they're required to do more advanced planning and prevention. Similarly, EPA has a program coming out of the 1990 Clean Air Act amendments. It's very similar in structure to OSHA PSM, and it's called an EPA Risk Management Plan. Now, these two programs are so similar that in most cases, many times, but not necessarily always, but many, many times, if a facility is subject to one, they're subject to both. Most facilities that are going to be subject to PSM are also going to require to have a risk management plan, RMP, and vice versa. Most facilities that are subject to RMP are probably going to be PSM facilities. That's not an absolute rule. And over the course of my career, I have known of or been affiliated with plants that are in for one, but not the other. But those tend to be the exception, or maybe they're in both programs, but not the same chemical list. Okay. Large quantity generators of hazardous waste. So that's a regulatory definition. EPA says you're a large quantity generator if you have the potential to generate more than 220 pounds of hazardous waste a month. 2,200 pounds of hazardous waste a month. That's the equivalent of about 4 or 5 drums. If your facility has the potential to generate 4 or 5 drums of hazardous waste a month, you're a large quantity generator, and you have to have a very specific kind of contingency plan, and that's spelled out in the EPA regs that identifies where your chemicals are stored, your spill response equipment, your firefighting equipment, your evacuation routes, your assembly areas, your third-party notification protocols. How are you going to call the local responders? Are you going to call any contractors? You need to have all this very specifically pre-planned. So facilities have these plans. You have to drill these plans. You have to practice these plans. You have to train all your employees on these plans. So that's another one that many facilities, even if you're a small quantity generator, they're going to be the ones generating 220 pounds or more. So 220 to 2,200 pounds, that's about half a drum to 5 drums a month of hazardous waste. They're required also to have certain preparedness, prevention, and emergency procedure requirements, not quite as robust as a large quantity generator contingency plan, but it's also not a free pass either. They have to meet certain minimum requirements and have those, be able to demonstrate those to anybody who would ask. Additionally, EPA has a whole program with regard to spill prevention, control, and countermeasures. That comes out of the 1990 Oil Pollution Act. And these are facilities, generally, if you imagine 24 55-gallon drums, so 6 skids with 4 drums per skid. If you have 6 skids of oil material at your facility, you're subject to SPCC, these spill prevention, control, and countermeasures, planning and preparedness requirements. This one also requires annual training. This SPCC plan is usually in 2 parts. You have your spill prevention protocols that you're going to practice, and then you have your control and countermeasures for when things go wrong. So that has to be pre-planned for facilities that have oil in quantities of 24 drums or more. Also, the 1990 Oil Pollution Act requires large petroleum distribution facilities. So think of terminals, refineries, port facilities that have large tanks on site. They're going to have what's called a facility response plan, and that's like an SPCC plan on steroids. They're not dealing with, a 10,000-gallon tank on site. They're dealing with a 1,000,000-gallon tank on site. So those large facilities are going to have this robust facility response plan that is required to be coordinated with the local emergency planning committee in the jurisdiction where they reside, and also with the regional administrator for that, either that region or state's Clean Water Act administrator. So that has to be coordinated with them. There's a new rule, a relatively new rule. It was published in 2024. Now, currently, the last I heard on paper, it's still required to go in effect by June 1st, 27, but EPA has indicated that they're pushing that date out, giving it a longer implementation period. But what this program will do, once it becomes fully rolled out and enforceable, it will require certain facilities that have certain hazardous substances above their reportable quantity to develop hazardous substance facility response plans. It's going to be modeled on the Oil Pollution Act facility response plans, only instead of being for oil, it's going to be for certain chemical. So that's in the pipeline. It's coming. The 2027 deadline is indicated that it will be pushed out, but that's still in the works. Here in Louisville-Jefferson County, anybody who's been in town since the 1980s, if you grew up here, February 13th, 1981, the Louisville sewer system exploded, and it did explode. That was an explosion. There was a release of 2,000 gallons of hexane to the sewer system, and a dragging muffler hit a cast iron manhole cover, and it blew up several hundred feet of, or maybe thousands of feet of sewer line in West Louisville. As a result of that, the city alderman at the time and MSD, whose sewer was badly damaged by the incident, decided they don't like having the city sewers blow up. So they drafted the county's hazardous materials ordinance, and that ordinance requires that facilities in Jefferson County have a hazardous materials use and spill prevention control plan. So basically, facilities are inventorying everything they have on site, disclosing that to MSD, the Metropolitan Sewer District, who's the administrator for this rule, and then they have certain preparedness and response procedures built into the plan that they have to submit to MSD, and MSD holds them to this. So one facility can have multiple plans in place. They're usually overlapping, and a minimum at the facility level, we need to make these align. There's always the option of integrating them and, covering several different regulatory requirements with the same plan, as long as you make sure to check each regulatory program and make sure that you're meeting the requirements of each one. Because there's a lot of overlap, but there are some distinctions. Additionally, a couple more rules. anywhere in the United States, certain regulated substances, hazardous substance, EPA has designated reportable quantities. So if you release so much of a material inside of a 24-hour period, you would have to report that release to your federal, state, and local authorities. That's a combination of the CERCLA rules, the Comprehensive Environmental Response Compensation Liability Act of 1980, and the EPCA rules of 1986. So basically, if you have a release of a chemical above its published reportable quantity, you're making 3 or 4 phone calls inside of 15 minutes to make sure that the local authorities have a chance to respond to this release as well. Additionally, the Louisville Metro Air Pollution Control District, that's our local air agency, they have Regulation 1.07 on the books that says if you have an incident that causes upset emissions, so you have an upset condition at your plant, something abnormal outside of your routine operations, outside of what you're already permitted to do, any upset condition that causes excess emissions needs to be reported to the Air Pollution Control District inside of an hour. That's at the facility level. At the community level, so you look at this flow chart over here on the bottom right with the orange blocks, all these local emergency response agencies and regulatory authorities, they all coordinate together. We do have a Louisville-Jefferson County Metro Government Emergency Operations Plan. So that's a 165-page document. Last I checked, it was updated in 2020. And basically, that 165-page plan covers a whole range of incidents that could occur, and it directs the community responders' response. It establishes lines of authority, it establishes communication protocols, it establishes coordination, responsibility, so on and so forth. So that is out there. And then there's an even more specific Louisville Metro Hazard Mitigation Plan. That's a 735-page document, last updated in 2022. That plan was developed for Louisville-Jefferson County, and that's going to have very specific implementable protocols. So if you had to evacuate a certain area of Louisville Metro, how would that look? Who's in charge? Who's running that? Who coordinates it? If you had to respond to flooding or wildfires or biological event, something like that, that's all going to be in the hazard mitigation plan. This is going to be a lot more specific, saying this is who's going to do what. Those are both out there. You can search the web for either of those titles and get access to them. They are both public. Okay. So before we open it to questions, I want to introduce this last little green quote that we have here. And I picked this up a while back, and we slid this into the slide deck. Safety is the presence of control, not the absence of risk. So I'll say it again slowly and for impact. Safety is the presence of control, not the absence of risk, okay? We can't go back in time. So remember all these things that we looked at on the very first slide, the very first day, all these things are made with synthetic chemicals. If we want to have these things, many of them made out of petroleum, plastics, rubber, heavy metals, things like that. If we want to have these things, we are going to have chemical manufacturing, chemical transport, chemical processing, and chemical use. Okay? They are all made out of chemicals, and some of these chemicals have hazards. And the transportation and storage and use of those chemicals may pose identifiable risks, but risks can be managed and controlled. Safety is the presence of control. That's why we have risk management plans, emergency response plans, planning and preparedness plans. Nobody wants to have a hazmat incident. Those of us who are working in industry, who are storing, handling, processing, using, shipping these chemicals, we don't want to have hazmat incidents. So we go to a lot of effort to manage and control those materials to make it a safe environment. Okay, last content slide here. We want to talk about risk tolerance. Okay, so we talk about risk management. Let's talk about risk tolerance. So this is something that's inherent to a person's general persona, right? Some people are like roller coaster people. They thrive on adrenaline and, a high risk activity can be a intriguing challenge for them. Okay. People who go into high risk careers like, law enforcement, those people are wired to respond to a high risk situation. Other people are just wired differently. Some people are very risk averse, and that's okay too. There's not a judgment here. It's just different individuals bring a different risk tolerance to the table. Additionally, we talk about voluntary risk and involuntary risk. So I can use the example of cigarette smoking. A cigarette smoker has assumed, they have voluntarily assumed that risk. You have all sorts of education programs out there that the hazards and risks of cigarette smoking are well known. But a cigarette smoker has chosen to accept that risk. They feel that they're in control of their own behavior. Whereas a person who's not a smoker, but may be exposed to their secondhand smoke, they may have a very different reaction to the involuntary risk that is being posed to them. So people tend to accept voluntary risk greater than they are willing to accept involuntary risk. And that makes sense too. So the whole point of this class has been to introduce these concepts, to talk about it frankly and openly. And at this point, we really want to invite your questions and comments. And Dana, I just see your comment there. I will update the slide. Thank you with regard to the operations plan mitigation plan. I'll go back and I'll update that. So at this point, we want to invite everybody. If you have any questions about anything that we discussed in any of these 3 sessions, please come off mute and I'll do my best to answer them. Anybody?
Yeah, Corinne,
Yes.
I have a question. I was wondering, with the lessening of relaxation of many rules from the EPA, federal EPA, due to the current administration, do we see that flowing downhill to the local regulations?
So one example of that is the hazardous substance facility response plan I talked about, the fact that that's getting kicked out. Those rules would have gone into effect June 1st of next year. And last I heard, they're being pushed out, not eliminated altogether. There were some rules that were proposed or published late in the Biden administration, and there's something like a 6-month look back. So anything that was done in the last 6 months of the Biden administration, the Trump administration has the opportunity, if you will, to go back and remove some of those. There were some updates to the risk management plan rules that were proposed late in the Biden administration. My understanding is that the current EPA is looking to rescind some of those details. The program itself will still stand. The devil's in the details. So there is some concern there for sure. Other areas like last week when we talked about all the different air pollution regs, EPA has pulled back their endangerment findings. So essentially the current EPA is signaling its intent to no longer regulate greenhouse gases in the same way. So there are certain greenhouse gas rules, particularly the greenhouse gas reporting rule is if it's not going to be removed altogether, it can be not enforced by the current administration. I do believe the AIM Act, which was specific to causing reductions of those hydrofluorocarbons, the HFCs, now because that one is supported by a treaty that the U.S. entered and it was ratified by Congress, they don't have the same flexibility to go after that or to start pulling out requirements of that. So that we are seeing some of it at the federal level. But then again, here in Louisville-Jefferson County, we have the Louisville Metro Air Pollution Control District. They publish their own rules. And even if federal EPA is going to back off of certain things, that doesn't require the Louisville Metro Air Pollution Agency to pull off the same things. Now, greenhouse gases were never regulated by Louisville Metro anyhow, so that one is squarely in the wheelhouse of the federal government. But things like hazardous air pollutant regulation, ozone, criteria pollutants, particulate matter, all that, they're federal standards that are also, the Louisville Metro is tasked with enforcing them. Does that answer the question?
It did, Corinne. Thank you.
Anything else? Anything you want to talk more about? I'm leaving this visual up here kind of as a visual prompt of all the different kinds of things we discussed. If you want to discuss any of it anymore, okay, I'm looking at the chat. I'm going to update those plan dates. Thank you. Can we send you the recorded sessions? So we are recording them, and behind the scenes, the Louisville Emergency Planning Committee, the organization that I'm part of that put all this on, does not have currently, we're working on it. We do not have our own website, and that has been a big communications challenge for us. We basically had this whole course out and ready to go and very little ways to manage it. We're in the works of having our own website. We've got a consultant who's working with us to help build that as we speak. And we're also, I believe, planning to put these recordings up on a YouTube channel. So when that is up, I can go back to this distribution list and share that with you. Like I said, we're working on dates for Q3 and Q4. We're targeting a trio of dates in August for the third quarter and a trio of dates in November for the fourth quarter. The third quarter August dates should be in persons. We usually meet in person at the Air Pollution Control Building in Old Louisville. And then the fourth quarter dates in November will be online again. So we'll share those dates with you. So if you found this to be helpful and you could share it with somebody else, we'd appreciate the recommendation. If you don't have anything else for me, you're free to go. But if you want to stick around and chat, I'll be the last one to log off here. Thank you all.